earlier on in the process, there was there was some discussion of the licensure requirements, and this seems different. So maybe I need to connect with you outside of the meeting and
Sure.
ask more questions,
I'd be
because
glad to do so.
um I feel like there was like hours of supervision and all sorts of stuff that were needed. So maybe we were looking at incorrect information.
Yeah, I'd be happy to do that, Amelia. Please reach out.
Thank you.
Yeah, and I think when we get down to the section about training and workforce development, I think this is like really ripe for that section. And so to be able to talk through that and get clear on that, but also and be able to incorporate some of these comments, but getting clear on sort of what has been recommended for a training and workforce development. So we'll get to that section. And so also wanting to make sure I like capture all of these so that we can bring them back when we get to that section. But I know Annalise and Ellen have their hand up. So Annalise.
Please remain on the. Your call will be answered in the order it was received.
Yeah, I was just gonna say, I had brought up very early in this process, and I'd like, if you scroll back up, I'd like, or maybe it's here, but in some part, where we talk about gaps and areas for coordination. I guess, I mean, my perception is that children in school, whether they're 6 and 7, or they're 10, or they're 12, or they're 13, there is some support for children exhibiting these issues. But if those children are in an after school program that is outside, or after school care that is outside of the outside of the school district, outside the school, or they're in childcare just in general, the only quote unquote coordination or resources or assessment that occur for those kids within that context is wait till something happens, report the provider, determine that the provider failed to supervise, it's the provider's fault, and the childcare provider, right? The childcare provider's fault, and cite the provider for a licensing violation, maybe hold them responsible for neglect, right? Find that they were neglectful, and do absolutely nothing to actually deal with the real issue and help the child and the family. And that is a disturbing trend that I see happening over and over and over again in childcares across the state. Like sometimes it's a child that's 13 or 16 because they're special needs, and they're in that childcare program because they can't be left alone after school or before school or during the summer or on a day off when there's no school. So there's got to be something done about, the way we deal with challenging sexual behaviors in childcare in this state is to go after the provider, hold them responsible, and do absolutely nothing to actually solve the problem.
Okay. So for this particularly accountability gaps, this like that it's sort of disparate and there's no real person to like make sure that there's no particular agency or anything. There's no framework for ensuring that children are getting services, and also that sort of blame gets shifted around to like the caregiver. So we can make sure to expand on this section to include some of that. Ellen, is there anything if you've had your hand up for a while as well.
Yeah, it's just going back to what we were talking about previously, and one of the things that, and I think it's in some of our notes, but what we had discussed and what I mentioned in the chat being sort of a third path was, well, number one, making sure that everybody all throughout the state is clear what's available for how to be certified and the different pathways. Perhaps that would be something, but we also talked about different ways, like maybe like has been done with suicide prevention, where we've had trainings that have been able to go out to people that work in whether it be childcare or domestic violence or community mental health, so that everybody's on the same page and everybody understands. And maybe they don't have all the tools to assist, but they do know how to get the ball rolling, and more of a peer program. And I've attended some national things on the suicide prevention, where they've utilized people who have with lived experience. And so I think there's just numerous ways, but if we do something like that, or if we recommend that, there has to be clarity in what the steps are and how people can, and it can't be too hard. You know, because people have these busy lives, there has to be some step-by-step process, or maybe, and then other things, you know, you could have another level of where other master's level clinicians are able to access this or do this at a lower cost, or at or at least have the tools they need in some of these community mental health centers and various places that are consistent with the Sex Offense Treatment Board's recommendations, you know, just so that everything is, that there's clarity and a pathway. And maybe that gets talked about more in the workforce piece that you were mentioning, Shannon. Yeah, but I just wanted to put that out there.
Yes, thank you, Ellen. Yeah, that particular comment that you had about looking at other response systems like suicide prevention and things like that, I definitely made sure that we had included that, because I think that's great. Yeah. And some other sort of like peer support models for sure. Okay. And then there's sort of, we wanted to name some other risks that didn't quite have sort of a place in another section, but wanted to like call them out as particular risks with this work of inconsistent messaging, funding fragility, that there's sort of a resistance from certain communities, particularly, and then also the policies can impact access, and then workforce burnout. So are there any, there's like like 1,000 risks, there's like a lot but if there's any additional risks that come to mind that you want to have named in this work before going into the recommendations, this is just sort of some additional context setting about some of the gaps and some of the risks before going into sort of what the recommendations are. So any additional ones that come to mind? Knowing you will have time to think about this too and don't have to say the last thought today.
I guess I would add, and maybe this kind of falls into inconsistent messaging, something we kind of have talked about in our work group, and I certainly have experienced, is like the worry about kind of starting to maybe talk about this problem or type of behavior that's new for a lot of people, then can lead to over responding or like inappropriate kind of over responses as we're kind of helping people find the appropriate level of response. So I think that's related maybe to messaging concerns, but I would love to see that spelled out there. And I think, again, maybe within that or separately, I still think about, I think Judge Svetke mentioned this early on in the process, but the worry about like creating a whole new group of bad kids when we're talking about this. Like, again, I'm not sure how to label or kind of write that in here, but I would love to see like that risk really acknowledged, because I think that's something we can mitigate with intention and thoughtfulness and collaboration. But that's certainly a worry of mine.
Yeah, 100%. Okay.
I don't know if we want
Okay.
to include this, but I mean, there is a risk of not addressing some of these things because one of the things that we've been talking about is I know that we keep talking about under 12, but like I bristle at that because there's no magic thing that happens at age 12 that turns you into a different kind of human. And one of the things that we talk about in our unit a lot is that work with children and youth is prevention for the adult system. And when we don't address situations for children and youth, they become adults at some point. And so there is a risk of not working effectively with children and youth. They will become adults who have even more significant behaviors or more significant sexual acting out. So if we don't have an effective way to work with children with problematic sexual behaviors, there is a risk of more significant concerns later in life.
Mm-hmm. Yeah, absolutely. Yeah. Yeah, Debbie. Touching that, adding to that. Okay. Recommendations. Woo! All right, let's get into the meat of it. Okay. This first bit is just a general overview. So I might just give folks a couple minutes to read through.
Very happy that the first one says get rid of that.
Okay, any particular notes or feedback on this first section about the description about the pathway design? I feel like this might need to here. Does that make more sense? Right. Okay. And then based on some feedback, we wanted to include in some of the notes, like a sort of specific example of for like what a specific stakeholder should be looking for in and expect from the pathway. So we did this with judicial alignment. And so created sort of a table about how this pathway might connect with the juvenile court system, what like people working in that system can expect, and when judicial involvement might be appropriate. This, oh yeah, that's a great. Oh,
So can you
Thank you,
go
Jessie.
higher up with the beginning of that section?
mhm.
So you say here, when in doubt, a judge is supposed to request MDT consultation? Is that what that means?
Mhm.
Because that, I mean, that's not how courts and judges work. We can't ask for additional information outside of what's presented to us in a courtroom. We're prohibited from doing that, and we shouldn't be doing that because it doesn't provide all of the parties the same information. Judges can't go outside of the evidence presented in the courtroom in order to make decisions. Judges should be trained, but in individual cases, we can't do what that first sentence is suggesting.
Okay.
I wonder if differentiating, and I don't know if, yeah, I see John, and I don't know if Jocelyn's still on here. Like the way, I guess, in my experience, the way I've seen that kind of consultation be effective is when it's the district attorney or the juvenile department. So especially when we're thinking about how juvenile cases work and kind of one of those decision points. So I would defer to folks who work in those systems to clarify if that feels appropriate. But in my experience, that's kind of the step that I found to be really helpful in meeting kids' needs. Is from that, again, that like DA or juvenile department level.
Well, the DA can, or juvenile department or ODHS can bring in information into the courtroom or present it to all of the parties, but there can't be a consultation between the judge and any of the players in the system, because that's ex parte contact, and that's a step that judges are prohibited from taking, and it would mean that judge can't then hear that case.
Yeah, so I think it's just clarifying the statement that it's not judges requesting that, it would be other parties like the DA or the juvenile department.
Parties should be encouraged to bring in experts or bring in witnesses who can educate the court and the parties, but not a consultation.
Okay. Okay.
Font is really small. I think the rest of that is good.
Okay. Okay. And then this is a section about sort of operationalize it and having sort of a detailed protocol with a visual flow chart. We are working, we have a graphic designer who's working on the like visual flow chart for the pathway. And from the like designing a system response work group. So wanting to just name that we're working on a visual. Yeah.
Hey, Shannon. I-
Sorry.
Oh, I just want to mention real quick about the visual, and I hate to do this to you at like, I feel like it's the 99th hour, but I again want to kind of like tie in, you know, looking at and potentially aligning with some of the jurisdiction recommendations that, you know, they've got their flow charts in there, which are amazing, but a lot of their recommendations are built upon designing and developing an alternative pathway that allows DHS the opportunity to do prevention work. Right now, we don't have kind of a legal venue to do any prevention work. And with the 40, the jurist's recommendation for an alternative pathway, that it would be a visually very different flow chart, right? And so I just want to throw out there a recommendation that you consider dueling flowcharts, one based on our current kind of statutory, lanes that we operate within, and one if those recommendations are adopted.
It would also potentially be possible to turn the pathway flow chart or charts into a bench book for judges. I mean, the charts could then become a bench book so that around the state judges have the same options in front of them and the same information in front of them.
Helpful. Okay. All right. Governance. We had so many comments about governance, so I would really love people's, I want to make sure that we actually incorporated them appropriately. So I know this is kind of like a meaty section, but wanting to, let me try and I'm gonna try and see if I can zoom in a little more since we said the font was small. Is that better in terms of font? Okay. All right.
Please put DELC up above, that membership should include representatives from ODHS, OAHA, ODE, DELC. Because DELC is no longer under ODE, it's its own department. DELC needs to be in there.
What are the letters for DELC? DL.
DELC.
Okay, that's what I thought.
Because that's the other half of education in Oregon. It's ODE and DELC now.
If we're recommending that the 12 and under 12 and above 12 distinction go away, why would the task force only focus on under 12?
I don't think that does the oh yeah.
That was a recommendation above, and we're talking about having it have a more developmentally appropriate lens with, recognition of individual developmental stage and potential, IDD. So just thinking about what that looks like if the age 12 stops being so relevant, which I would recommend. So just thinking about that. So yeah.
I can just share, I don't disagree with that, Jesse. I can just share that recommendation came from the Designing Systems Work Group, so I can just share a little context around that. I think when we were kind of after the last meeting and kind of starting to look at recommendations and hearing from Jeff's presentation, I think we were just kind of thinking about capacity and focus, that like feeling like in the short term, the biggest gap where there's like a lot, maybe more lack of clarity is with that group, that maybe I would say to me that like goal of moving away from that line feels like a great medium and long-term goal that we should move towards, but that maybe in the short term, the biggest need is to address that population. I think just the other piece was just thinking about, capacity and addressing a really, really big bucket of things. And it might be helpful to start with something a little bit smaller and then broaden. So yeah, I think all those things maybe can be spelled out, but that was kind of the rationale for us including that.
that makes good sense, short and long term, with a goal to be moving toward blurring that line, but for now, that makes sense to me. Thanks.
And I think for sure from our folks who do work within juvenile departments and the juvenile system, like acknowledging the role, making sure we're acknowledging the role and efforts that do exist and the great work that is being done, and wanting to maybe see again in the long term, like that pathway, be broadened and clear across those developmental needs, but understanding where we're at now.
Okay. We can work on calling that out
Yeah,
of sort of
that
long term,
beautiful and clear. Shannon, take on that easy job.
yeah, we can work on that. Okay.
I think, Shannon, one thing that I would clarify, if you scroll up about a sentence, the ensure implementation fidelity to 4086 recommendations, I think we need to call out that I mean, we're just recommending to the legislature, it's going to be, this task force, if it's brought to inception, I think we're going to, instead of just the recommendations, going to have to be whatever is legislatively adopted, right? That's what the task force is going to have to, and, make it specific to the CSB and not the juris, this task force. Thank you.
Spelling errors, but yeah.
Can you define convening agency for me? Sorry.
Line. Oh, yeah. Trying to find where that is.
Stop. Go up one line. ODHS will serve.
See. Yeah. Yeah. So I think this came up. Oh, I don't remember whose comment this was. But to play more of a sort of a convener role of like bringing the parties together, but not necessarily sort of dictating like what is done, but just sort of coordinating, bringing folks together.
I also think, so it says that I volunteered to be the convener. I think it says that it was my concerns about punitive system processes. I don't know that they were just my concerns. I think there was a concern maybe noted somewhere that was like, is this really DHS's role? And I said, we would be happy to host, just because there's always this concern that like, children have these problems and therefore DHS should step in. And I agree, we'd be happy to be a convener or alongside ODHS or whatever. So I just want to make it clear that like, we are not trying to take over, or I am not trying to take over. If ODHS would like to continue in the role of convener, that is great. Happy to come alongside, or if DHS is like, please get us out of this, I'm trying to step in as an alternate solution. So just want to make sure that that doesn't look like, I don't know, that I'm saying DHS ought to get out of this and we're more appropriate and have it look like it's crappy and I'm trying to convene a coup. That is not the intent here.
In terms of just kind of a gathering force, like, and I think that's a role of DHS that we've been put in a lot, and that's okay. I think you know, again, like our legislative, like our statutory ability to become like involved in families that we don't have an investigatory in with is limited. And so again, like legislation, like we would have to change our statutes to allow us to do some form of work beyond investigating child abuse if we were to have or hold of a role, you know, to kind of firm of a role within that. And it makes me nervous, that role being responsible for, you know, accountability to prevention and resource availability. And, you know, I mean, those are a lot of things to put on the shoulders of one agency. You know, I think this would be the task force's charge, right? Is to be the ones who start addressing adequate prevention and supports. But I hesitate, whether it's ODHS or, you know, whether it's anybody, I think it's too much for the shoulders of one entity.
So yeah, I think OHA is happy to be a partner agency, come alongside you.
Mhm.
And I don't know, maybe I can volunteer OYA as well if they want to come alongside, or maybe that's not appropriate. I don't want to voluntold anybody. John.
Yeah.
I think we're trying to keep these kids out of OYA, so maybe that's not appropriate.
Okay, we'll have the two in there for now, and then we'll see if other folks speak up and want to volunteer themselves. So, okay.
Yeah, a young man that I worked with last spring here in Umatilla County, because our community mental health doesn't have anybody that is certified to work with youth with problematic sexual behaviors. That was his parents' main concern, was that he was approaching 12 years of age when his behaviors may have risen to the level, you know, if it got egregious enough, risen to the level of OIA involvement. So it is that 12-year-old mark is a motivating factor. And that might be why the original legislation included it. And it's also kind of the standard in the industry of pre-12, post-12, because a lot of things in adolescence start triggering at that age but I don't remember who it was, but somebody said developmentally appropriate, and it's been mentioned in there several times, but that is key. It is a developmentally appropriate thing. It's just by statute, 12 is when things start shifting.
Okay. Okay, does this look right for OHA as the administrative home for the plan of operation? Yep. Okay.
We want it.
Okay. Does this look right? Right. So trauma-informed frameworks and supportive roles.
Mm,
This also has a specificity about age. Just gonna write a note.
My recommendation would just be to remove or broaden age range kind of throughout the board. Or say children and youth or something.
Mhm. Okay.
mm,
Clarifying role of CACs. Parent advisory board. Should we change this to a caregiver?
Yep, I think so.
Um. Sorry, Shannon, I need to go back just a little bit. I'm reading a little slower.
Oh, you're
Um,
fine. Yeah.
that additionally, Oregon should explore the specialized, could you change the language for or add language for sibling sex abuse cases or cases that involve youth experiencing complex sexual behaviors? Just because it goes so far beyond whether or not we have a formal allegation of abuse between two siblings.
Yep.
I'd like to suggest, this is Annalise, I'd like to suggest if I could that I think the parent advisory committee is a great idea, but I feel like the agencies and the parents and the providers and the caregivers should all be coming together. So maybe, while having a parent advisory committee is great, I think that that parent advisory committee, at least some of those members should feed into that initial committee. I also think that if you're gonna have a parent mentor program, I would call out something for, that chat that DELC needs to ensure that something exists for childcare providers. And the different, licensed and exempt and whatnot, where they can bring mentors and folks dealing with this from a other kind of caregiver perspective. So that those would be my inputs there.
Yep.
And there's already a group, it's called the Every Child Belongs. And I think and it's to prevent expulsion and suspension of children from childcare. And that might be something that could be I don't want to say thrown in, but I think that group would be a good fit for
Mm-hmm.
taking up some of that work, because these kids get expelled from childcare programs, and they tend to get bounced around. So that may be a good place for DELC to start.
Yep. That's great. Okay. Community dialogue and stigma reduction.
Can I
Do these
ask,
objectives look good? Go ahead, Veronica.
can I just ask about the community forums um being convened, like where the ODHS being the driver or of these community forums? I'm just interested in that conversation.
Yeah, I think this came from the idea of ODHS's role as like a convening agency of just sort of like bringing people together, whether it's for the task force or whether it is for like events. And so, but I think as we named earlier, that like getting clear on what does convening agency mean and is it all on ODHS? No. So I think this part could use some clarifying as well. So maybe it's that like the task force, the agencies and organizations that are represented on the task force can like help convene and organize community forums in partnership with community-based organizations. Okay. I don't know if Jesse named in the chat of that community forums may be overly complicated and sort of a one-off and may not do much to reduce stigma. Is there anyone from the community education work group who wants to maybe speak to these? Yeah, they are listed as ongoing, but we could name a like a sort of context is that they like in order for these to be successful, they one need to be ongoing and like address the like clear objective of reducing stigma.
Yeah, I guess what I'm worried about is this may be a place where the groups could have used some time together. Like we had talked a little bit about, and someone was, I think Ellen was kind of talking about, like I talked about sort of a structure a lot like the suicide prevention trainings where there are kind of a like a level, I keep doing this, it's kind of like a pyramid, where there's like trainings that are really broad. So they really are for everyone. The trainings that are for like everyone in a community are for, you know, would be for parents and community members and peers and childcare workers and preschool, you know, and anyone who interacts with a child really in any way with no clinical background of any sort. And then the way that the kind of the suicide prevention model works is then there's another level for, you know, folks who like work in schools who have kind of more of a direct connection with students. And then there's another level for people who have more specific clinical training. So if someone says, you know, oh, I just wish I was dead, you know, there, you don't have to say, oh my gosh, we need a therapist, oh my gosh. Like literally everyone in a community should know how to kind of have that conversation and have some level of understanding of kind of suicidal ideation and what to say next and just sort of understand. And then, you know, people who work in a school or even in a treatment center or something have a next level of sort of how to screen for problematic suicidal ideation. And then when you actually have screened in, like, oh, actually there is something concerning happening here, we need to kind of bump that up to someone who really knows what they're doing, then they can kind of head up. So we had kind of had a conversation about that and kind of layering that sort of framework onto problematic sexual behaviors. And that bottom level really is around, in the suicide prevention world, that bottom level is around kind of reducing stigma around suicidal ideation and around talking about suicide, thinking about suicide, because there's so many people who still think of suicide. Like if a suicide happens in a family, there are people who just don't even want to acknowledge that it was a suicide, can't even talk about that because it's so embarrassing, it's so shocking. And we're trying to sort of destigmatize the even a concept of suicidal ideation and suicide happening in a family by training everyone that like suicidal ideation happens all the time. So many people have had suicide attempts. Like there are lots of people who are walking around all over the place who have had suicidal ideation or suicide attempts and are survivors of a suicide attempt. And so that stigma reduction could come through training like that for problematic sexual behaviors. And we could do community awareness of developmental and appropriate sexual behavior as well. And so like that could be something that we could do to sort of marry these two ideas without having separate kind of separate ideas. And so I wonder if that is a way that we could kind of address all of this in the same way without having two separate sets of recommendations. But I wasn't part of those conversations that were happening around these forums. So I don't know if that would address the concerns for the folks that were thinking about these forums, if that would address kind of what you were thinking, or if that is completely off base and you are just thinking like that is the dumbest thing ever. We had a whole separate conversation and that would not address it at all. So
I think that's excellent, and I really appreciate that, Jesse. And I also not really knowing fully what the forums are, but one thing I do want to add is, you know, important to reduce stigma, but also I do recall that we talked a little bit about shame, because the there is so much shame, obviously shame with the suicide prevention and people who, as Jesse was just mentioning, people who've had who can't even admit that there has been someone who's taken their life in their own family. But I think the same thing with the complex sexual behaviors. There's so much shame around it that we have to also call out shame and in some way address it. Because it's not just a stigma, it's internalized at such a deep level.
Yeah. Okay, we can definitely add that in there. And then I think, Jesse, I think what you're saying actually is quite complementary to this, in that it adds just a level of nuance in terms of like what are the objectives of the forum given the different audiences that might be there. It might be more of a school place audience, and then therefore the forum might have a different objective than a like open wide community. So it just adds a level of nuance to it. So I think we can build that into this and just give some more specificity to it, and give some guardrails to, it's not just sort of an open call, anyone, and we'll say all the things, like that's not it. Okay, so yeah, we can work on building that in. Mhm.
Okay, yeah, thank you. I think that that's sort of like what we were talking about, and yeah, it does kind of build a
Yeah.
structure of like,
Yep.
what is the nature of the conversation? Who is it for? What's the audience? And then sort of, yeah, kind of building in destigmatization, addressing the shame,
Yeah.
building in it's, it also is sort of what John was talking about earlier, building in some clinical capacity as well, so that therapists do know a little bit more of what they're doing, know when to screen, and when to get a youth some more kind of more specific help, so to be able to say like, oh, I am not an expert in this. I need to get the situation to someone who knows what they're doing. And so we had kind of talked about that as a little bit of, kind of layers of training and building in more expertise within the field, within the state.
Yeah. Yeah. I think that's great. Okay. Next section. We're moving along. Community and mental health resources. This particularly just talks about like really expanding the resources that are available.
Hey, this is Annalise, and I just want to say I really appreciate this part of the report. I think it's very well written, and my gosh, thank you. Because I think this is really where this is the big call out right here, right?
Yeah.
Real quick before you scroll past that, we go up just a little bit. Under the Engage Higher Education Institutes, I had a comment in there about incorporating it into undergrad programs as well, depending on, oh, up one, sorry.
Yeah. No, yes, I think I put that in this next section of tiered
Okay.
training and workforce development. But if
Perfect.
if it's not there, I want to make sure that we capture it here. So I'm gonna add a note here just in case.
Thank you.
Mhm. Also, hi JJ. Any other additions or changes to the section? Okay. Tiered training and workforce development. Ooh, John, that's very helpful. Thank you. All right, tiered training and workforce development. Okay. Core components, training on the continuum of normative sexual development, instruction in trauma-informed responses, evidence-based clinical models, and cultural humility and racial equity. Expanding access. Here it is. Baseline PSB education should be embedded in and develop PSB specific coursework for graduate and undergraduate programs. Just gonna add your comment again here, John.
This is Annalise. I'd like to make a suggestion. So licensing boards and professional associations, can you just go, Ed, can you scroll up a little bit? I'm trying to figure out where childcare fits in there. We do not have a licensing board. We have Department of Early Learning and Care, which has their license, is a license, has a licensing agency within it. So
Okay.
we don't really fit under either of those sections. And I don't necessarily want to say that there's a requirement because, for example, if a childcare program only cares for children up to, if they're an infant and toddler program, I don't know how relevant requiring one of those programs to take training on something that's never going to arise in their program. I mean, that children are under the age of 3. But so I don't know where we, I mean, our local is already working on developing something. We've talked with Delk. We're getting approval to have it not mandated, but that people get a stipend or some sort of reward beyond their certificate. But we don't, our childcare would not, preschools and childcares would not fit under any of the umbrellas that we have here. So. And I wouldn't want to require it, but I do think that there should be availability for childcare programs.
Can I pipe in here? Annalise, to your point, I think that's valid in that how to make it accessible and not burdensome. However, we just did Higher Ground just did a training for Washington County nurses that are like the visiting nurses in home and some of their other staff. And though they're 0 to 3 and they're expanding to 5 unless the funding got cut. It was really helpful information for those providers to have that so that they were informed. And though they may not work with those children and families, there were older siblings that were in those families. And again, it's a different context than what you're talking about, but again, maybe it's not required, but available, to your point, is that information. The more we can get information out about what is healthy and normative and concerning, and that if they've got a 3-year-old that's sharing that they may have had some inappropriate touching happen by an older sibling or someone else, those providers then would have that information and response system and support. So just wanted to put that in there.
Yeah, no, I totally agree. I can tell you though, as an infant toddler program myself, I think that information for me is helpful in some situations. But the minute a parent confides that in me, that's happened, I'm now stuck reporting that. Right, that I know there's sexualized behavior happening in the home. The children aren't being supervised. So now I'm, as a mandatory reporter, now I've got to go rat them out. And so I mean, an infant or a toddler who's been sexually abused, I mean, I guess, yeah, I would want to know that, but only if it was going to be relevant to my work. And I know that sounds horrible, right? That I would not want to know if some child if one of my daycare kids has been abused. But it can explain why a child is behaving the way they are if they've been abused and they understand they've been abused. But I also, I don't know, it's a hard walk, right? It's a really hard walk.
I mean, it feels like this is our opportunity to like culture shift. I mean, at the end of the day, whether or not, people specialize with different age groups, like all of the agencies in here, we're all interfacing with families, right? Families that are growing and changing and moving and developing. And, I just feel like this is our opportunity to shift from a culture of, I'd rather not know, kind of the ratting them out, to how do I go about and how do we build something to where I can say, okay, family, you're experiencing this, and I'm going to connect you or send you down this pathway to get you the kind of help and support you need. And I know that we've, despite kind of everything and how we've gotten here into the culture that we have, but I think what we're trying to grow is something a little bit different in whatever way that we're interfacing with these families. We're building capacity for helpers to help, even if it's a little bit outside, it's at a very generic level, to connect them with the resources they need.
Mm-hmm.
Yeah, no,
Yeah.
I get Debbie and Veronica, I get your point, but this isn't going to change the law, right? So I'm still going to be obligated, and this family may already have intervention. We, the jurisdiction work group, we've talked about how traumatic it can be to a family to have to go, have multiple investigations and whatnot. So I'm not saying that as a childcare provider, I don't want to know, or that I'm not going to mandatory report or any of those things. I'm just saying not all of us, it's not going to be relevant to all of us. And so I don't want to mandate it, because to be honest, if a 12-month-old baby has been sexually abused, or a 2-year-old, it may not affect the work that I'm doing with them. And yes, I want to protect kids, and I, want to care for a child trauma informed, but I also don't want to make things worse. Do you know what I mean? So, by going overboard. And so,
Yeah, I
a
think,
fine line.
yeah, I think there's consensus around making it accessible and not required. But I think, Annalise, you're also talking about what Justine had sort of named at the beginning as a potential risk, is the like over response. And so I think finding that balance, so if we can add that to the top in that potential risks that at the top in that context, I think that can help in this as well, and sort of, I think, speak to some of the things that you're naming too.
Yeah, that's a really
so-
excellent point. Because right now it's always an over response, always. And I mean, I'm not going to bore everybody with the details, but childcare programs are so hyper vigilant because they can lose their license if a child inappropriately touches another child. That it's an immediate expulsion of the family. It's reports. It's having to deal with your own investigation because when you report it, it's a self-report against your own program as well. So now you've got Otis and you're breathing down your neck. And it's a very stressful time. You're probably, if you have ERDC is going to pull the plug for 6 months and not fund your program. So, and that means all your ERDC families have to leave your program. So now you've got financial devastation in the childcare program. So yeah, this is so complex for childcare.
Yeah. Okay, so we will make sure to have a section in here to specifically call it out since it's not under doesn't fall under these other umbrellas. And then, Annalise, I will send you the updated section about this specifically, if that's okay for you to just review to make sure I've like captured this appropriately.
Yeah, no, that'd be great. Thank you.
Okay. All right. Culturally responsive practices and equity. So, Katie had dropped a comment in here. I think she had copied and pasted it from somebody else's comment. That just says, I hope the mental health work group has included this, but highlighting that I want to make sure the impact of the SOTB guidelines are mentioned here or elsewhere in the report. We need oversight for this work to include and acknowledge developmental differences across populations. And so, wanting to make sure that this section addresses that. So I think Katie kept that comment in there because she wasn't sure that she addressed it. So if you can hold that in your brain as we are looking through this.
For the equity piece, do you want to name a specific equity framework in the beginning? So like at ODE, we have the ODE equity framework and lens that we use when we develop anything. Like, is there a specific one to OHA that you can name as a guideline to follow when some of these materials are curated or these programs are curated, to be more specific so that everything is aligned?
We often use the GARE tool, GARE.
Is it? Okay, yeah. That one is Jesse's.
I'm trying to remember what GARE stands for. It's like government.
Something racial equity,
Yeah,
government.
right? I don't know what the A is,
Yes.
but yeah, is it a
Yes.
government application of racial equity government?
Yeah.
I can look it up, but
Is
yeah.
it Oregon specific?
No.
No.
It's not.
If you're sending this report back to the legislators, if it's Oregon specific, I think that you're going to get more buy-in.
I hate that that's true.
I'm sorry.
I know, you're probably
Ugh,
right. But I
written
just,
in
I
30
hate that we like have to be unique.
I'm
But
sorry.
you're probably right.
Yeah. JJ, could you share the ODE one? That one's Oregon specific?
It's ODE specific. That's why I
Oh,
was wondering
okay.
if OHA had one. Do you want me to dig around and see if I can find it?
If you
Um,
could, that would be amazing. Yeah.
Gotcha. Just a sec.
There we go.
For the statewide trauma informed framework, ODE is currently in the development of a framework for schools and support. So if you want to put in, gosh, it's so still in document form that nobody really knows about it. So maybe keep that in your pocket. But it could be linked to that work. And we've really started it in multiple areas, but we're putting a more finalized like together piece on it. But it's already in like our health and education work as well. But like any framework to connect to ODE's trauma informed work in schools for alignment.
Yep. Great. Okay. Any other comments or thoughts on culturally responsive and equity work? Okay. Do people need a break? I'm happy to keep going. I just looked at the clock and we've been going for an hour and 45 minutes before we dive into the riveting world of policy and legislative action. Do people need a
How
small
many more
break?
sections are there?
So we have the policy section, shared resources, and then there's sort of like a timeline of immediate and like longer term next steps, and then we're good.
Maybe we could just keep going and
We can push through. All right. Policy and legislative. So generally it just sort of says aligning things and then it goes into specific actions. Any changes to these key actions? Okay. I'm gonna quick scroll back up and put your link in there. Care framework. Okay. Okay. Additional legislative recommendations for implementation. So having legislative champion, designated line item in the budget, interagency agreements, having a comprehensive case rate or cost rate, and then publicly funded mental health providers receive training. Additional ones.
I'm sorry, can you scroll back up just for a second? I had looked away for the tool.
Sorry.
Just to the
Yeah.
top of this section. I apologize, everybody. Everybody was reading and then, okay, no, that's just, wait, no, just for the legislators. I missed the first bullet point. Thank you.
Yep.
Cool.
Okay.
Thank you.
Mhm.
Shannon, did you get the ODEORS that I put in there in the working doc?
Hmm.
Because there's ORS that already has funding tied to it for this work.
Okay.
Part of it that
I feel like I did, but okay. Okay.
is this gonna, will you be put for the task force, are you gonna be asking for, and if you don't know, you can say, I don't know, but are you gonna be looking to put in an LC in the 27, 29 session? Is that what it's gonna recommend? Sorry, a
I don't
legislative.
know.
concept. Okay. That's what I
Yeah,
was.
yeah.
Okay,
I don't know.
okay,
Yeah.
sorry. If that was the case, like adding a budget to an ORS that already exists can sometimes be easier, especially if you're doing like cross-office collaboration, can be seen as really strong. Sometimes, depending on
Okay.
the legislation session.
Okay. I think if you think that's a strong recommendation, like a pathway to go, then I think we include it. Yeah.
Doesn't always work, and it is just my opinion based on what I saw last session. And things always change. Putting that caveat in there.
Okay. 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 This table, I want to check with, as we had talked about earlier, about checking this with the juris recommendations. But this table shows sort of like the current language, proposed updates, and reasons why. So it's just sort of a summary based off the bullets above. Maybe to change this. Next one, mandated reporting thresholds. Response to sibling sexual abuse. Update to MDT protocols.
Their partnership with education in that piece. There's a legislative mandate in the ORSs that I put in that other section, that it's 339.341, and it's actually the OAR underneath it.
Okay.
For education and their involvement in sexual violence prevention, which is our CERC process. So just to kind of define that connection in that pathway, so we're working together and not separately.
Okay. Yes. Okay. One of the bullets above talked about MOUs and information sharing. Okay. That's the end of the legislative policy section. We feel good about that. All right. Shared resources and tools. Talks about sort of creating a resource hub with information. That is also this hub of resources is maintained by the interagency task force. So would have a public facing directory of clinicians, trauma informed education materials, messaging templates, all the flow charts, all the pathways, all the visuals. This also has a varying by age, so I'm going to make a flag there. Change that. Having toolkits for local, regional, county level committees, and having a suite of learning modules, as well as information on behavior charts, and then a public communication toolkit and a crisis and referrals list. And just that there would be like quarterly content reviews to make sure that the information stays up to date. How does that feel for this resource hub? Good. Okay. All right, last part is our timeline, implementation timeline. So the idea being that in winter 2025, that there'd be a short-term implementation task force that is launched. But I'm going to add Delk to this. Yes, Jesse.
Two things before we move into timeline. In the, well, I guess in the funding or in the legislature, I didn't see, so I am very, very, very happy to take this on in our unit. I didn't see any funding for our unit listed. We would need funding to do it, that we need a person.
Yep. We have a whole section down here on funding. that
Okay,
is
that's why I
after the
was like, I was
timeline.
sort of waiting to like, I will wait for it.
Yeah,
I'll
yeah.
be patient, but
You wanna-
like in
we
the
can go-
legislature portion, it was like dedicate things, we would need the legislature to know that they would have to dedicate resources for this. So if that's in the funding section, I'll be patient.
No, yeah, let's maybe go through the funding section to make sure, and then we can go back to the timeline.
Okay, yeah,
Yeah.
and I can be patient too if it's in there, that's
think-
not a problem.
think
And
that's good.
then I just want to put a pin in, there's one particular thing that I want to make sure is in the clinical section at some point when we get there. I just wanted to roll back at some point. Because I didn't
Okay.
see it, but it might have been there.
And, in this clinical section of the evidence-based approaches.
Yes.
Okay.
Yes. Or in community oriented healing centered, yes. Best practice systems, yes. You can go ahead and scroll down. There's one thing that I want to make sure that we are stopping.
Oh, good.
Lovely, lovely. Report recommends. Can we specifically say that we would like to stop doing, what is the fancier word for lie detector tests? Somebody help me.
Seismographs,
Thank you. Polygraphs. All I had was P. It was something. Yeah.
both versions.
Yes,
Yep.
that is what and that we talked about it a bit in our clinical group. It is not a recommended treatment really for anyone. But I only have control over supports for youth, and it is absolutely not recommended for youth at any point as a best practice. And I
Yep.
need us to stop doing it.
Got it.
And
Yes.
John is not here, but I have also spoken to folks at OIA. There are some folks at OIA who feel strongly that it should stay. John is not one of them, so I feel comfortable. John is on board with that, so.
Okay.
I think I could echo that same sentiment, Jesse, at Higher Ground. That is not looked at as best practice, but Oregon has not adopted that change. So I'm glad you're bringing that up.
Yeah, just wanted to make sure that that made it into the report as a specific recommendation. So thank you.
Okay. Oops. All right. We have too many tabs happening. Okay, perfect. All right, let's quick look at funding before we talk about the timeline.
What page did you just jump to?
This is-
Oh, I got
I
it.
just jumped. Yep,
32.
32. Yes. So this is a summary of the current funding options. Okay. Then we have just sort of a table.
Philanthropy?
Mhm.
Oh, no, it's in the paragraph. I'm just questioning it. I don't know that that's something that we want to depend on necessarily.
Okay.
If others think that that is sustainable, I could be sold. I'm just curious.
I think it's good to throw it in there because some of the other things are turning out to be iffy as well.
It was really thought of more as possible startup, like I think.
Yeah.
But not a sustainable funding source, especially possibly for some of the rural or under-resourced areas that at least start up, but not sustaining.
For childcare, if you could put in there the legislature to increase funding to the Oregon Family Child Care Scholarship, that would be amazing. Thank you.
Okay.
That would be the primary funder of the work in childcare that's going to happen in childcare.
Child care. Say the full name again. Oregon Child Care Scholarship.
At least for licensed family childcare and probably eventually exempt childcare. Also, I guess John and Betty Gray Scholarship would be the one that would cover centered people.
Okay. Okay.
On the prevention side for education, our school safety prevention specialists who work with all of our school districts and train them, full funding for that program would be amazing. Because right now we're, the legislation did not pass our funding, so we're down a few, so our coverage is lower. So prevention funding for the school safety prevention system and specialists. And that's under ORS. I can give you the number for it.
Yeah. ORS
339.341.
Okay. Okay. So these are the funding needs. Here is a description of what is EBP? Where is EBP? Oh. I literally copy and pasted this comment. So
Yeah,
I'm not
it's
sure what
fine, and I feel
what
like I should know
EBP
that, but I don't. It's okay. I can figure it
Yeah.
out.
No, this is all true.
Yeah. Do you know what EBP stands for?
Evidence-based practice.
There we go.
Thank you.
The most obvious. Yeah. Okay. Okay, so these are the funding needs. This is a description of some approaches to getting that.
And a document that I sent to Shannon to include in this has additional information about how to possibly look at the work with CSB as a specialty, and that possibly the reimbursement, I'll give you some examples that cultural and linguistically specific services, they're reimbursed at a higher rate. So that cost rate, but it looks at the level of training and expertise that has to happen in order to provide the services. And again, some of the models that have already been adopted into that, like the CLSS, there was another one too, but that this population needs to be kind of considered as as needing more equitability in accessing services and to be looked at as through that framework. So I'm not doing it justice right now. It's a pretty lengthy document that has more specifics about how the funding could be presented to the legislature in the proposal. That speaks to some of what our concerns are about the training and requirements to get someone certified to provide the services. But it does not cover, I don't think, to Jesse's point about how to get their organization funded specifically to have the oversight. So that I would agree needs to be in there. So hopefully when Shannon is able to read my document or upload it, it can be included in this.
And we could be
I can read it now.
frugal. We can, and we do a lot with very little, but if we're gonna be receiving reports from people on the equity analysis of their programs and coordinating things, I mean, 2 staff, that we could do a lot with very few people.
Yeah. Okay. Okay, so this section is going to get a lot more detail once now that I'm able to open the document. So yes. All right. Let's go back to timeline. All right. So the idea being that in winter, the implementation task force, a short-term implementation task force starts. We have on here that the lead for like convening it would be ODHS. Do we want that shared or still ODHS?
I like shared.
Okay, I defer to Ronica.
Okay. And the idea being the task force is working on getting detailed implementation for each of the work groups that are recommended. That of the recommendations that are going to be adopted, working on interagency commitments, all of that, starting to get that stuff clear. Does that feel right for short term? Okay. Before that happens though, which I'm now realizing these are out of order or they're not sequential, we should adjust them. Is that before then is being able to disseminate the report and then to do some community engagement, have some meetings with the legislature, talk with partners to be able to share the information. So I'm going to flip the order of these where it's sharing the report and then yes. Veronica.
Can I bring something up, Shannon? And this is, I really want to defer to those who have a little bit more legislative experience than I have. But I know that these are being presented. I know there's the next short session isn't scheduled until spring of 2026. I mean, my understanding is that if they convene in the fall for an emergency session, it's probably going to be in response to a lot of the federal I'm not necessarily anticipating that we're going to get any legislative action, clarity, recommendations until spring of 2026 at a minimum. And so, you know, in just looking at the timelines, and there's some of these things, you know, establishment of a task force. I mean, certainly some of the things can start to happen without resources, without funding. I want to be realistic, and I want this to like reflect what is and is not kind of within the scope of possibility without legislative response with some certainty and or funding to kind of go along with it. Does it make sense?
Mm-hmm. Yeah. So,
I'm fine.
I mean, I just wonder about, you know, making implementation of recommendations based on adoption of some of the recommendations, like maybe within 1 year of recommendation adoptions, like these are the benchmarks. Within 2 years, these are the benchmarks, instead of adhering it to a timeline that I don't think I anticipate the clock to start ticking until next year at minimum.
can you say that one more time about
No,
making the
no,
time?
that's right.
Making the
Starting an
timeline, the
Yeah,
implementation to adoption versus,
Yeah, the implementation clock would start at adoption of the recommendation or defining of the legislatively adopted recommendations and progress from there
yep,
instead of
yep,
this kind of moving straight into some activity in the fall that we don't have the information we need to necessarily start.
yeah,
Yeah, if nothing's
okay,
been approved, we can't implement anything.
yep,
Is that
okay.
One
Well, that
thing,
makes reviewing this section relatively easy because we just need to overhaul it. Yeah.
one thing to keep in mind as you're building it out is how do you stay away from non-funded legislative mandates? So as you're reading, Shannon, can you scroll over and like, as I'm reading this section that we have highlighted right here, is it DHS and ODE? Oh, yeah, DHS and ODE should partner with culturally specific organizations to develop and distribute trauma-informed education materials. But how do you fund that? Because then that's going to come from who at DHS is going to do that? Is there a position for that, or is that going to fall on somebody's plate who already has a position, who is already is probably doing two people's job? And the same thing at ODE. Well, if it's legislatively mandated, we're just going to have to find that if there's no funding behind it. So that would be like, can you recommend a new law, or can you recommend a change in an ORS, and then underneath that fund that with a position to create those materials or something like that? Or if you're going to create like an ongoing task force, give it a sunset date if you need it, but within the task force, this and this will provide recommendations to the legislature or whatever.
I'd also
Yeah.
like to add that DELC should be included in this, but DELC already does that partnering and does that. We already do that in education, that trauma-informed education. So I think continuing to fund and continuing to maintain would be important.
Hmm. Great. Okay. So this whole timeline section, we're gonna rework and flip around.
Don't
it
get
could-
rid of
Okay,
stuff.
the other, sorry, go ahead.
What were you going to say, Jesse?
Oh, I was just gonna say, it could say something like 3 months following implementation or 6 months following. And if funding, 3 months following, if funding exists, these things, which could be, you know, done without funding, 3 months following, if funding is approved, or, you know, like, so that there's sort of a tiered sort of system of implementation.
Yeah.
Sorry, JJ, go ahead.
Oh, I just said don't get rid of it because I think these are the pieces that
Yeah.
you need to build out
Yeah.
what you're asking. Yeah.
Yes. Yeah.
You have
Yeah, totally.
yeah.
Yeah, maybe just a caveat at the beginning and the end that the implementation plan below is contingent upon funding to, and then something kind of at the end. Without funding, the above implementation recommendations will be severely limited and, just.
Yeah. Yeah, for sure. Okay. So we can do that. The other sections in here that we don't need to go through today, one is this like work group summaries, and it basically we just like copy and pasted the theories of change that you all created and just sort of have like summaries of what the work groups, and then before the recommendation section, there's just a whole lot of background information. So there's an executive summary, and then there's sort of history of HB 4086, which work groups, what did they work on, some of the methodologies, the things that you all learned about adaptive leadership and healing centered engagement and all the things, the like values and group agreements that you all made. There's some stuff taken about sort of from the research and from all the presentations that people came and gave about giving some background information, some context about CSB. And then there's sort of a map of the national and state landscape. So these are things that I think if you have time before August 1st to read through and give comments on, fantastic. Most of this is stuff that like you all already saw and gave feedback on in the earlier sort of research that was done. But wanting to, if people have time before then to add comments to this, that would be fantastic. What will happen from here is I'm gonna go through all these notes and make all these adjustments that we just made. And then going to take these, oh yeah. Yeah, resources section. Awesome. Thank you. Full list of resources. Yeah, there's a whole resources section. If there's anything that you think we should add, please send it over in an email and I will make sure that we add it. Great. Okay. But I will work on integrating all of these changes, all of this feedback, and then we're going to send out on, my hope is on Monday to be able to send out sort of draft number 3 to everyone, in addition to a simplified like survey. So the Juris Committee did a survey about these are the specific recommendations that are included. Do you like agree with this? Do you have any changes you'd like to see made? And just so that for folks who don't have time to read through the whole report, but just want to make sure everything is clear and that everybody kind of consents that like these are good enough for now and safe enough to try recommendations for putting in here. Those are that's our language that we're going to be using, is good enough for now, safe enough to try, as it is an iterative process. So we'll send out that survey and a third draft of this report. And then that will be, you'll have until I believe August 1st to be able to give additional comments, give additional thoughts. How does that sound? Okay. Jesse, I know in our last meeting you were like, oh no, we're not going to make it. How are we feeling now?
Better. Thank you.
Okay. Okay, good. I'm glad. I was like, I really want to make sure Jesse believes that we can do this. So, yeah.
I think I feel
okay.
like my role sometimes is to be the voice of the people who go into the subgroups and grumble and mumble and then don't say anything in the large group. So I
appreciate it.
apologize for sort of like
No, I
being the
appreciate
person who
those
speaks out.
voices. So, no, I am very grateful and appreciate those voices. So thank you for being that person. And yes, so, all right. We might be able to give you back 40 minutes of your time.
Yay.
Incredible.
Shannon, can I just
Thank you,
say,
Shannon.
your ability to navigate that document, take notes on the side, input information from the chat, like that was just pure magic to watch.
Yeah.
Thank you so much. That was, I mean, it was
Yeah.
beautiful.
I was just going to
Thank
say
you.
the same thing. I was really impressed with your work to consolidate, gather the thinking and put it over. Oh, yeah. Definitely magic.
you.
Great work. Thank
you. I really appreciate that. I care a lot about being able to synthesize, so I thank you. I will take that. Awesome. So yes, I will work on cleaning this up and we will get you a third draft and a quick survey so that everybody can consent to these recommendations, and we'll keep moving. Thank you all so much for your time and energy and expertise. This is incredibly helpful. So thank you.
Thank you.
Thank you.
Great day.